Hi, I'm Lacey Nobles with the City of Lubbock. Our news conference will start in just a few seconds. Good morning and thank you for joining us for the City of Lubbock COVID-19 news conference. We thank you for joining us. It has been a while. So today we have updates from the Health Department, Local Health Authority, and City leadership. Today's panelists are Director of Public Health, Catherine Wells, Public Health Authority, Dr. Ron Cook, Council Member Latrell Joy of District 6, Director of Emergency Management, Joe Mowdy, and Mayor Dan Pope. So let's get started with Catherine Wells.
Good day, everybody, and it's good to have everybody join us. The COVID-19 numbers in our community continue to climb. On average, over the last week, we have diagnosed 450 new cases of COVID per day. This is too much for a community our size. There are now 5,285 active cases in our community, and we have lost 283 members to this virus. And there are also countless others suffering long-term side effects. Over the last couple of weeks, I've had to sign condolence cards, even among our staff here at the health department. Some of them have lost loved ones. They've been tirelessly working on controlling the spread of this virus, and it has hurt them personally. We all know what must be done. It's not easy, it's not fun, it's not popular, but we all must make sacrifices so that we can have our loved ones at our holiday tables next year. I've talked about this before, but it's so important that we all follow this public health guidance until we have a vaccine available. Remember, wash your hands. Make sure you keep physically separated. That means 6 feet away. Also wear your mask. We're seeing more and more data out there showing the benefits of mask wearing, both for the person wearing the mask and somebody that you encounter. Make sure you follow the guidelines on quarantine and isolation. If you've had a high-risk exposure and have been asked to stay home for those 14 days. And if you have been diagnosed with COVID, you must isolate for 10 days and make sure that you are symptom-free for at least 24 hours. And if you think you've been exposed, we have plenty of testing options available here in the community, so there should be no excuses to being tested. The Texas Department of Emergency Management has 3 sites available. That's at Rogers Park, at the Texas Tech Museum, and also at the Larry Combest Center parking lot. So there should be no excuses for getting tested. And if you need help finding a testing site, please call us at the Health Department, 806-775-2933. And with that, I will pass it over to Dr. Cook.
Thank you, Catherine. Today, what you're going to hear from us is at least one, we're in trouble. Good citizens, the city of Lubbock is in trouble and our community is in trouble. The second theme here is we have to do something different than what we're doing now. Right now, our hospitals are full. As of last night, we have 12 patients that are holding in the emergency rooms at Covenant UMC that have no bed in the hospital to go to as of last night. And you just heard, pardon me, you heard Catherine say about 450 positive new cases every day. I have reference materials that tells me about for every 1,000 patient or 1,000 positive tests, about 11 additional beds are needed for the hospitals. So people have to leave to get those beds at 1,000 tests per day, 11 or 1,000 positives per day. So we're in trouble. We've set up field hospitals both at UMC and at Covenant. We've received extra staff and personnel from the state. Mind you, that's only temporary people. Our frontline staff have worked hard from the very beginning of this crisis since late February, early March, and especially since the 1st of September. Our numbers have skyrocketed. Since the 1st of September, we have 7 times the number of patients, COVID patients in the hospital at this very moment than what we had just a couple of months ago. Many of our coworkers and frontline people have had little time off or no time off. They're diligent, hardworking experts, but they are tired. The other thing that we've done to give you a better picture of what our hospital numbers look like in the city is, let me refer you back to the dashboard. What we've created there is the open number of beds that we have between Covenant and UMC. We also include in there those open number of beds, but it also has how many patients that are admitted that don't have beds. Those are patients that are on hold or being housed in the emergency room until they get to the floor. Now, emergency room care is excellent care, but it's not ICU care and it's not floor care. It's emergency department care, which is excellent care, but it's not the same thing as being in the ICU or up on the floor. So I want you to go look at that website in that dashboard, and it gives you a much better picture of where we are. Right now, Covenant and UMC, 50%, roughly 50% of their total number of patients in their respective hospitals are COVID patients. We've got to do something different. We've got to do something different. This Thanksgiving needs to be different. It must look different. We've got to stop the spread of the virus, and most viral spread is in small groups, especially small tight groups, not wearing masks and usually around food. The CDC and what I recommend is that we have no groups larger than 10. And if you are in a group large at 10 or less, make sure that you isolate to your family unit, to those people that are in who live under your roof. Okay. So, and only sit next to those people. Make sure that you wear a mask unless you're eating, and try to make the group size small and make it as brief as possible. We've got to slow down this virus. And remember, I talked early on about flattening the curve, and above the curve is where the hospital can't handle the capacity. We're way above that now. We got to get back under the curve. And the way we do that is we wear a mask, we socially distance, we keep our groups less than 10, and we wash our hands. We can do this. We've got to slow this virus down. Make sure your Thanksgiving looks different this year and the following holidays until we get this under control. Nothing shows that you care more for others than wearing a mask and socially distancing. That's all that I have. Let me hand this off to Joe Mowdy. Thank you.
Thank you, Dr. Cook. I'd like to thank the state of Texas and their partners, BCFS, for the quick deployment and the logistics involved. It took about 2 weeks to 2.5 weeks from the time that we requested the mobile medical tents to the time that they're operational. They've sent staff and equipment from across the state to help provide those resources to Lubbock. In total, the state of Texas, through their contractors, have provided approximately 350 staff to assist the hospitals, medical facilities in Lubbock needing staff. Those requests are not filled overnight. It takes approximately 10 days to 14 days before we receive those staff members. Right now, 82 of those staff are dedicated just to the mobile medical tents utilized outside those hospitals. Now, this pool of staff is coming from contractors that also provide staff to El Paso, Amarillo, and other regions across Texas, and they are running short on staff members. They work 6 days a week, 12-hour shifts a day, and they're here for about 2 weeks before they have to rotate out and rotate in a new staff person to take over for that shift. So staffing has been critically impacted in our area. Luckily, we do have some facilities that, as their staffing needs have recovered and as their staff has reported back to work from quarantine or exposures, they are able to release those state staffing resources for other facilities to use. Thank you to those staff that have come into our area to assist in our need. At this time, I'll turn it over to Councilmember Latrell Joy.
Shows my video to be stopped. So, good morning. Latrell Joy. I have occasion to be out and about in the city when I have to do some of my city business. I am still seeing people who don't wear masks in groups. That's unfortunate. And now that we're in the Thanksgiving season, I get lots of questions about what are we supposed to do about Thanksgiving? Well, I'll tell you what happened to my Thanksgiving. My Thanksgiving has been disrupted because my oldest grandson is a senior at Tarleton State University in Stephenville. He and his 3 roommates are quarantined because one of his roommates has COVID. So he won't be with us for Thanksgiving. It would be real easy for him to hop in the car and come down and want to spend time with us, but that decision's been made. He is going to follow those quarantine orders and he'll miss Thanksgiving. So what do you do on Thanksgiving? Well, Dr. Cook has already said you can celebrate with members of your household, people that you've been around and you know their situation. You can do that. You can Snapchat, you can Facebook. There are lots of ways to communicate with family during this period of time. Decorate your house for Christmas. The people that are there can help you. Put up your Christmas lights, do some things like that, but do it with members of your household. You can hold a virtual gathering if you choose with your friends and family. And, we could prepare some of our traditional recipes and drop those off at the doorstep of someone who can't get out and hasn't gotten out, particularly some of our elderly people who have been basically in their homes since March, and they don't get out because they're afraid and they're scared. So do something for somebody else, but don't do it on a one-to-one basis. You can even watch holiday movies. There are a lot of things that you can do over Thanksgiving to be with your immediate family and friends. I had a call yesterday from someone who said, my dad wants to have everybody into Lubbock for Thanksgiving. And when she said everybody, she was talking about people from Kansas and other states. First of all, why would you want to come to Lubbock right now? We're a hot spot. Doesn't make a lot of sense to me, but we just can't do that. Maybe we can do that next year, but this year we cannot. We cannot do that. That is not safe, and we should not do that. We've got to avoid those large groups where we don't know where people have been. And so if you'll keep it close to home with the people that you know, then perhaps we can make this work. We cannot forget the elderly people who have been in their homes and no place to go for long periods of time. So let's don't go out and make this any worse. Let's try to flatten that curve, and let's be good citizens and good parents and good family members, and let's adhere to all the guidelines that the health department and Dr. Cook have provided. Thank you. Mayor, are you ready?
Yes, ma'am. Thank you, Council Member. Good morning, everyone. I want to start by sharing some data. If you'd let me, I'm going to share my screen real quick. Pardon me for not being at the beginning. Okay. So positivity rate, by the way, I would just remind everyone that this data all comes from our COVID dashboard on the city health department website, which is updated every day. You see our positivity rate. I'd make a couple of comments here. One, we're averaging about over the last week, 10 days, we're averaging 15 to 1,700 tests a day. So still lots of testing, but the positivity rate is way too high. My message today will be around how we slow the spread. And this is an indicator that the spread is running rampant. Dr. Cook did a good job talking about our hospitals. This shows, and as did Mr. Mowdy, this shows it in graphical form. I want to pause just for a minute and talk a bit about our 6 to 17-year-old age group. This is a little more problematic today than it has been. And where we see a lot of the problems here are not in the classroom, but in our extracurriculars and in the decisions that our kids are making. As an example, 4 kids are carpooling to swim practice or golf practice after school. And if they have to carpool, they all need to be wearing masks. It's hard to tell kids that, but it's important that they do that to be safe. Remember that they're very likely to have this virus asymptomatically, but are a very healthy and active carrier it spreads to the rest of the community. We're doing a little bit better in our 18 to 25-year-old age range. And this is our case count by age over the last 14 days. And I'll let you look at this, and you'll I think agree with me when I say that the spread is throughout the community. We used to could point it to our 18 to 29 and say that's where the most of the spread is. And that's not the case any longer. Okay. So let me make a few comments about what our approach is going forward as we work on limiting the spread. We're working on public facilities and large indoor gathering areas. The city manager will be announcing before the end of the week that we will be closing our large facilities and our athletic facilities through the end of the year. We will also take our council meetings as well as all city boards and commission meetings virtual through the end of the year. We're working closely with Texas Tech. We like the approach they've taken to, in essence, give kids and the community an 8-week break between Thanksgiving and January 20th when they go back to school. They'll be implementing the same kind of move-in protocols that they did in the fall and trying to do things safely. We're in near constant communication with them. We'll be talking to our school districts more about how we can work with them to limit spread in indoor areas where we might gather to watch our kids play sports or hear them sing or play their musical instrument. We also are having very good success working with folks like Apex and Premier, those indoor athletic venues where our kids play volleyball and basketball. They are good partners and they work closely with our folks, and they will be continuing to implement mandatory mask ordinances requirements inside their facilities. We're, as we speak, working on arranging a meeting with our big box retailers via Zoom later this week. We will be asking them to self-impose some occupancy limits lower than what the state has put in place. We want all of them to be as good a citizen as Costco is. You can't go into Costco without your mask on. You can't shop in Costco without your mask on. We can do better. The state regulatory agencies have been good partners. 3 of our bars have been shut down because they can't follow the rules. It's important for you to know that they will be back in Lubbock this weekend working with us, both in the city and in the county. We will work on these folks that can't follow the rules. The spread, our contract tracing shows that many of our positive cases, including, unfortunately, at least one death, are from people who have been in multiple bars or entertainment venues. Often some of those who have a hard time following the rules, both inside the city and outside the city. We will continue to enforce the governor's order. That is what we are operating under today. We talked to the governor's office yesterday. We're in close contact with them, and they've been a very good partner. So let me conclude by sharing 5 quick things. First of all, I want to share my empathy to the families that have lost loved ones and are dealing with COVID today. You, like me, know these people. They're our church members. They're our neighbors. They're the people we do business with. I've been asking folks as I talk to them, both on the phone or electronically in the last week, how they feel. I hear them say they're scared, they're sad, they're angry or mad. And over and over, I hear people say some version of this: Mayor, why don't they care enough to cover their face, to stay at home, to do things that protect all of us? You know, my answer to that is that we can slow the spread. It's a matter of choice. We've got to do things differently. We need to shop local, but we need to do it online. I mean, our restaurants have become fabulous at curbside pickup and using delivery, whether it's their delivery or Uber Eats or DoorDash. Even old guys like me have figured out how to use those apps. Don't take your kids to the grocery store. Don't take them to Home Depot. Take them to the park. Send one family member if you are in a situation where you're single mom and dad. Find a safe way for your kids to be watched while you go to the store, or more, maybe even better, order your groceries and have them delivered to you. Schedule virtual meetings with your friends and families. Have your virtual cocktail hour. We've got to stay the course. We've got to remain disciplined and patient. There is good news in the future. The Pfizer and Moderna vaccines both have efficacy rates well over 90%. Our frontline health care workers will very likely receive this vaccine before the end of the year. It will be quite a bit, though, into 2021 before the rest of us will be able to have the vaccine. I ask you to dig deep, to do what's right for yourself, for the people you love, and for your neighbor. Please stay safe, be kind, and be hopeful. Lacey, back to you.
Thank you, Mayor, and thank you to our panelists. We're going to open it up for media questions now, and I want to go over the guidelines again because it has been a bit. We ask that you stick to asking a question and avoid offering too much commentary. You can ask a follow-up question if you'd like. And today's media order is Matthew Stell from KMAC, Brittany Michelson from Fox 34, Karen McKay with KCBD, Olga Guerrero from El Editor, Adon Rubio from the Daily Toreador, Sarah Self-Walbrick from Texas Tech Public Media, Adam Young with the Avalanche Journal, Alyssa Tellez from KLBK, and Christy Martinez Garcia from Latino Lubbock. So let's start with Matthew Stell.
Thank you so much, Lacey. First question is for Mayor Pope. Mayor, good to see you again. Let's talk about masks. And it's something that we heard Councilwoman Latrell Joy mention earlier. She says she's out and about, not seeing people wear masks, the same as for a lot of other folks. We were at City Hall yesterday for the public hearing. Within the chamber, we probably saw about 6 to 7 to 8 people not wearing masks, even within the chamber. Is it something political? Is it just a denial that things just don't exist? Why isn't it you think people just aren't wearing masks?
You know, Matthew, I appreciate the question. We had good mask compliance in the chambers last night. Unfortunately, we had to remind people several times of that. As you know, we had a revolving door of people in the chamber, and I can't answer that question. I don't. That escapes me, Matthew. We know in the middle of all this going on, I had 2 emails yesterday from people within our city who claim that masks don't work. Both of them citing science that's now more than 8 months old. But we have to do what we can do, Matthew. And I encourage people to do the right thing.
Got it. Second question, this can be for anybody. We've heard talks about the Civic Center being possibly used as an overflow for COVID-19 patients from the hospital. Is that being discussed at the city level, or is that just talk?
There's no plans for that at the moment.
Got it. Thank you.
Thank you, Matthew.
Okay, now we have Brittany Michelson with Fox 34.
All right. My question is for Dr. Cook. So a petition from local doctors and nurses asking the governor for more restrictions went up last night. And I wanted to know, are you involved with this petition? And if so, why? Why are you asking for more restrictions?
Thank you, Brittany. That's a great question. You know, the healthcare providers are tired. We've got to do something to slow it down. And we don't have any kind of legislation that can forcibly make a penalty to our masking policies. And it's a recommendation, it's mandated, but we can't do much about it. And so we're asking the governor to come in and say, we've got to do something different. We've got to stop this virus. And right now, we don't have access. The vaccine's coming. It's only for frontline workers. It will probably be late spring, maybe early summer before the general public can get full access to the vaccine. So we've got to do something different than what we're doing. And that's the only thing that we have are physical barriers. And that's masking, social distancing, and hand washing, and keeping our group size small. So yeah, I'm aware of it. I was part of it. And so, yeah, we've got to do something different.
All right, thank you.
Okay, now we have Karen McKay with KCBD.
My question is for Mayor Pope. You talked about closing large facilities. That announcement will come soon. At what point, Mayor, would you consider imposing a lockdown similar to what we went through months ago?
Karen, first of all, I'm glad that you're recovered and doing well. And
Thank you.
Yeah, we're not going to lock down, Karen. We learned a lot from what happened in the spring. That lockdown, as you recall, there's so many businesses that are considered essential that it sends a confusing message. And what ends up happening is the people who are most impacted by this are men and women who work for small businesses and own small businesses. And in the spring, we had a safety net of federal support with CARES Act for businesses and unemployment for workers. Those don't exist today. So it is important that we do what I've been talking about and what you hear Dr. Cook talking about and Ms. Wells and Ms. Joy talking about as we slow the spread and safely go about our lives.
Thank you, Mayor. I have a question for Dr. Cook also.
Thanks.
With more than 21,000 people in Lubbock described as recovered, many of us are wondering, really, what does that mean beyond the health department telling us that we are immune for 3 months? I mean, now that we're 8 months into the pandemic, what have you learned about, say, the risk of getting it a second time? And will people be counted twice because they actually had the virus twice?
We've not seen, Karen, we've not seen so many reinfections at this point. There's been a few. We have a way to identify those if it's truly a second positive in our database. And so right now we don't have very many of those. If any, and I'd have to get with Catherine and see, but there is a possibility. There's an absolute possibility that your antibodies in your bloodstream that help fight off the infection may wane after 90 days or so. So there is great concern. And we don't have a vaccine yet. Now, and let's not put 100% hope that the vaccine's going to save the world, because we don't know in the long term how long our antibodies from the vaccine are going to last. Now, we hope that they're going to last longer than 90 days, but that's the very reason why we have to get a flu shot every year, because the virus mutates a little bit, our antibodies wane a little bit, and so we just don't know. Our hope is that they will last at least 6 months, 9 months, 12 months. But yeah, Karen, after 90 days, maybe sooner, maybe a little later, it also depends on how sick you were, depending on your antibody response is after how sick you. If you have a mild disease, you may not have a great number of antibodies against it. If you have a severe disease, your antibodies you may have a higher level of antibodies in your bloodstream that may last a little longer. I would not take any chances. Just because you've had it doesn't mean you should be nonchalant and lackadaisical about your potential exposure to this virus again. Today, you're probably,
All right, thanks.
I wouldn't go any further than that.
Thank you. That affects more than 21,000 people, so we appreciate your comments.
Thank you, Karen. Now we have Olga Aguero with El Editor.
Buenos dias. Hello, everybody. It's good to see everybody back after a great election. A question for, I guess, Catherine. You know, the great news that we've heard is that the vaccine is coming out, which is a blessing that we've all been waiting for, and hopefully it will be. But is there plans already in place for the distribution of this vaccine? And what would you tell those people that are already voicing out of not taking the vaccine because of reasons, you know, but what would you tell those people, and how do y'all plan to encourage? Because if you don't take the vaccine and you carry, you could be systematic. You're spreading the virus. So,
Well, first one on vaccine distribution. one thing that the health department's always done is provide vaccines. We get 4 or 5, we see 4 or 5,000 children in our health department clinics, and staff's very good about doing outreach events. We have the cold storage, staffing plans to be able to provide drive-through clinics, set up clinics at schools, community centers throughout our community. So I think we will fall back on those things that we've done well in the past with the health department, bring in a lot more community partners, because it's a lot more people that need to be vaccinated than focusing just on our kids. As far as vaccine hesitancy, it's going to be a struggle, but we need to see the data, the information coming from these drug companies, and really let people review that before they make a decision. That information isn't out yet, and to hear someone already make a decision about whether or not they'll take it or not is concerning. We need to get all that information out there and then help people make the best decision.
Mr. Mowdy, Mr. Mowdy, would you talk just a little bit more about distribution? I know we're working pretty closely with the state. Can you add anything to what Ms. Wells had to say?
Thank you, Mayor. With the state, the city, as far as emergency management and public health, have both attended statewide exercises and planning meetings for the past 3 months on when a vaccine might happen, how to distribute it, how we're going to reach our community partners to help with that, utilizing our clinics and hospitals and other medical facilities, as well as priority listing of healthcare workers, frontline workers being first, and then affected populations like nursing homes, jails, that type of thing.
Thank you, Mr. Mowdy.
Okay, my second question is for the mayor and whoever else wants to answer or input it. I believe that after the elections and new administration coming in, I feel that this pandemic is going to be supported, because we're going to have people that actually voice that the concern is and the importance of science. But with that being said, Mayor, you said that you wouldn't close any businesses here, and I understand that, but I also keep in mind the people that are concerned with that, because regardless of the numbers, regardless of the hospital numbers and the deaths and all that, you're saying you won't close it. You wouldn't even consider, or maybe I'm wrong, maybe you would consider maybe mandatory of masks, since you won't consider closing businesses if we don't need to. But why not do monetary, put those masks on those people? I mean, what do you think?
Well, first of all, I appreciate you commenting on Mrs. Joy being reelected. I think that's the election you were talking about earlier. So I want to make sure that I thank you for that. No, we cannot and will not do a shutdown, another shutdown. I've made that clear. To the degree we can enforce the mask mandate, we will do so. And that's been my answer since the governor's order came out. And that's what it is today, Olga. And, you and I both know that it is a mandate in Texas that requires personal responsibility. And to the degree we can be accountable and take care of ourselves and our neighbor, we'll slow the spread.
Thank you.
Thanks, Olga.
Now we have Adon Rubio with the Daily Toreador.
Hello, everyone. I guess really my first question is directed toward Mayor Pope. Recently, Texas Tech released or sent out an email to students regarding tech athletic and December commencement events moving forward with extra health precautions. You mentioned that soon there will be plans to close down larger facilities. So how is the city helping to conduct these tech-related events despite certain facilities and activities being restricted?
Yeah, it's a good question, Adon. In fact, President Skovic and I talked about that very memo over the weekend and again on, I guess on Monday morning. And he asked me for input, and we actually talked a bit about it in our public health call on Monday evening. I believe I've not seen the memo. He told me what it would say. I think he explained again the way they plan on doing commencement, which we feel like the commencement event is being planned in an abundantly safe manner. Our only concern about commencement is the parties that happen before and after. I know that they, from an athletic standpoint, are taking men and women's basketball and those indoor events very seriously. And we'll continue to work with them. Remember that Texas Tech, they're our partner, but they make decisions for their faculty, staff, students, and events.
All right. Well, I guess for my follow-up question, more along line regarding the hospitalized COVID patients, I was wondering if anyone on the panel could provide any information or maybe ballpark figures on how many of those patients are made up of or come from the tech campus or even just other college communities in Lubbock.
Dr. Cook, you want to try that?
Don, very few are actually from Texas Tech campus or our university age group. Just in general are very, very low. And so it's not a huge number at all, Don.
All right, thank you.
Mm-hmm.
Sorry. Now we have Sarah Self-Walbrick with Texas Tech Public Media.
Hi, everyone. My question is for Ms. Wells. I'm interested in contact tracing. Now that the virus is so widespread in our community, how are those efforts going? And what have we learned about how the virus is spreading in Lubbock through contact tracing?
I will admit that contact tracing is definitely a challenge. When you start looking at, 3, 4, 5, even 700 cases of, in one day, it is very difficult to get, get a hold of everybody. We have pulled in some additional resources to help the health department make sure that we're getting those phone calls done. Through contact tracing, we've really seen so much of the contact and the spread occurring in those venues or, small groups getting together and spreading that disease. That's why we're pushing concerns about Thanksgiving and bringing individuals together in groups larger than 10, because a lot of times that's where people let their guard down, they take the mask off, and they're able to infect their close friends and family.
And then I guess also for Ms. Wells and Dr. Cook, probably, I know that there's a lot that adds to this, but as Texas Tech ends in-person classes next week, how could we expect that to affect our current trends?
Sarah, I don't think we're going to see a lot of change in our trend because it literally is everywhere in the community. Everybody we're just seeing it everywhere in the community. It's not just a certain age group. Everybody is spreading it. All the more reason to wear a mask and socially distance. I'm always going to go back to that. We can slow this down if we wear a mask and we socially distance and stay out of large groups. I have no doubt this community can do this. And so I agree that we don't need to shut down. We just need to restrict our group size and wear a masks and get our group size to small. We don't need to shut down. Not yet. I'm not leaving it out. But we're almost there. But if we'll do those things, we can slow the spread of this virus until we can get a vaccine. And it's not, this is an ultra marathon. This is not just a marathon, it's an ultra marathon until we can get the vaccine out for everybody.
Thank y'all.
Mm-hmm.
Thank you, Sarah. Now we have Adam Young with the Avalanche Journal. Adam, can you unmute yourself, please? Okay, we'll come back to Adam in just a second. Next, we'll go to Alyssa Tiez with KLBK.
Good afternoon, everyone. Thank you so much for your time. So we've heard many times that Lubbock is just a few weeks behind El Paso. So are we starting to maybe talk about getting refrigerated trucks, mobile morgues here with the number of COVID deaths that we've seen, or are we at or near this point at all?
Dr. Cook, you want to talk about that?
Sure, thank you. Thank you, Alyssa. Our numbers in our medical examiner's office, morgue, and other mortuaries here in town, we're close. We're close. The fire department has made some shelving units for us. We've gone to extra efforts to try to find more space, and with other local community partners, the Health Sciences Center, those sorts of things. But we're close. If we don't slow this down, we'll be calling for some extra space, and that may include refrigerated reefer truck stands for refrigerated trucks or mobile morgues. The DPS has some. There's other contractors that we could ask to come help us. We're close. It's not just a hospital thing, but it's a morgue and mortuary issue too. We're close.
All right, thank you, Dr. Cook. And then going into my next question, also having to do with hospitals, since we have 12 patients waiting for beds right now, when I spoke to UMC last week, they said they have no plans, as far as when I spoke to them, to start flying out patients. Is this something we're starting to talk about now, sending patients to other cities who will be able to take care of them?
It's probably always an option on the table. Most of that occurs, Alyssa, from University Medical Center in Covenant. This is a tertiary care center for our region, Eastern New Mexico and West Texas. And so as a result, those patients in those outlying communities, because you have to have a lot of pain in your heart from those communities outlying, because we can't accept any more patients in here when our hospitals are full. So those communities are then having to call Colorado and Oklahoma and other places, trying to get their patients who would normally come here to get our expert level of care. It can't happen. So it's the outlying communities that are suffering more than us trying to send patients out of our hospital, but it's those communities that would otherwise normally refer to us, having to find a place for those beds as far away as 2 or 3 states, Louisiana, et cetera.
All right, thank
The
you.
other thing I would add to that, Alyssa, is that we see sort of the super region. We know the Amarillo and El Paso situation, but some of the other areas around us are on the same track we are with hospital capacity. And so we can't lay off, can't share that capacity with them.
All right, thank you, Mayor Pope. Appreciate you.
Now we'll go back to Adam Young with the Avalanche Journal.
I apologize for the delay on my end. I had a couple of screaming quarantine children run into the house just as this was, as it came to me, the timing was pretty bad. I apologize. But just to kind of circle back on some of the themes I've been hearing, since a lot of questions have already been answered. I get so many emails and calls from people generally expressing skepticism about the messaging they keep hearing. And obviously you all do as well. What do you think the disconnect is? What would you suggest would be better messaging to share with folks in this situation?
You know, Adam, that's a
I guess-
great question. And if you get the answer, would you call me first? You know, we've tried to let the hospitals lead. We've tried to put people on the front lines out delivering the message. We've gone back to our press conferences. You should expect to hear from us again early next week to do another conference, much like what we're doing today, to update people. We will consistently try to make people aware of the situation and explain to them what they can do to help and ask them to help.
Understood. With obviously with the hospital tents here, what would any next steps be if, as you say, the trend will continue and if there's considerable lack of buy-in? What's the next step?
Yeah, so you've faded out there on some of that, but I think I can answer what the next step. First and foremost, it's to slow the spread. That's got to be the next step. We'll continue to work with our hospitals. We'll continue to work with the state. We have contingency plans in place. And as needed, we'll roll those out.
Thank you.
Adam. Okay, now we go to Christy Martinez with Latino Lubbock.
Good afternoon, everybody, and congratulations, Mayor Pope and Latrell Joy. Great job. I noticed that Dr. Cook is doing his Movember thing. It's a good look on you, Dr. Cook. Listen, guys, thank you for everything that you have done. I know that it has been tough. And I know that the public often wants to blame those in elected positions and those leading this charge, but we keep talking, or, personal responsibility is a big thing. I just had someone say, you might as well order those trucks, refrigerated or freezer trucks, because people aren't going to change. And just kind of in following with what Adam said about, personal responsibility and disconnect. Deaths continue to be a very big issue. And, I personally had someone die, and people just are not listening. They want to blame you. How do you handle that?
Well, I think we personally, I handle it with a lot of prayer, by consulting with a team, a good team, some of which are on this very Zoom today. And we, I think, remain steadfast and committed to our messaging. I'd like to kick it to Ms. Joy and let her add on to that. I'm sure she has a perspective that would be valuable to Latrell.
The deaths concern me greatly. If you ask anybody around City Hall, they will tell you. We all know people, and some of them close, who have died. Christy, we kind of have to have thick skin sometimes because of the criticism of us, because they think we're not doing anything. And I take great confidence in the fact that we're doing as much as we can possibly do under the current governor's orders. And we continuously try to find ways to do more to work around some of the limitations that we have. I think all of us need, during this Thanksgiving season, to get down on our hands and knees and do some prayer, not so much for ourselves, but that others will do what they should do. Thank you.
Christy, may I add?
Yes, please.
That each citizen in our community and surrounding communities has the ultimate control in not spreading this virus. Whether you believe in masks or not, whether or not you believe that this virus isn't as lethal as what we say it is, but every person listening and every person in our community has the responsibility not to spread this virus. Whether you believe it or not, at least be nice enough not to spread it. And we do that by those very things that we've talked about. You wear a mask, you socially distance, you keep your group size small, and you hand wash until we can get a vaccine that's proven to fix it. But everyone has this responsibility incumbent upon them, and you can choose to do that, or you can choose not to do it.
Thank you. I do have one follow-up question. And the Amarillo City Council is having an emergency meeting about fines for businesses not enforcing masks. And they're going to be holding that on Friday. And we still have a lot of the public that's asking, why are we not reducing, if we can't close these businesses, why are we not reducing the number of folks that can come into a restaurant or come into a public place? Would you consider, I know that a lot of times, Mayor, you have worked on following the lead of, or working collectively with other mid-sized cities like ours. Would you consider doing something where fines for businesses would occur, especially for those that are not enforcing masks or that are not enforcing COVID-19 rules?
Yeah, so it's a good question. I have not seen what Amarillo is considering. I was told they were going to consider something. I think Midland considered something last night, which failed. Mayor Payton has suggested he may come back with another ordinance. I think Odessa is considering something. I'm reluctant to consider something that puts pressure on business to enforce it. I don't think that's the right lever. I think it should be at an individual level. It's what we've been talking about. I do believe that we vote with our presence and our pocketbooks with businesses. Mm-hmm. If you walk in a business and they're not taking it seriously, it's easy to tell. And I suggest you turn around and hightail it out of there.
I concur.
That to me is the way we handle that. And the vast majority of our businesses have been really good partners. And there are a few that aren't. And we can choose where we spend our dollars and spend our time. And I hope that our citizens will do that.
Can I just ask one last question to Mr. Mowdy? I believe that's
quickly. One quick question.
The last question is, at what time will these makeshift hospitals be closed down? At what point would that happen?
Thank you for your question. We're coordinating with the hospitals to see when their capacity increases to when they don't need the tents anymore. As of right now, there really haven't been in-depth discussions on a certain date. It really depends on capacity and do they still need to be there or not.
Thank you.
Okay, that concludes all of our questions, and that concludes our news conference. Thank you so much for joining us, and thank you to our interpreters, and thank you to our panelists. Remember, our COVID information is updated every day, and you can find that at mylubbock.us/COVID-19. So we'll see you next week. Stay safe and have a good day.